we talk to health systems and pharma companies and other parts of the health insurance companies all the time, who are they're frustrated with entrepreneurs who show up and they've got something that, kind of in the abstract seems to make a lot of sense, but they haven't figured out really how the healthcare system operates well enough to have a viable product that's going to fit into the workflow, that's going to fit into the economics, and ultimately, it can be the best, the most interesting solution that makes people healthier and makes doctors happy and birds start chirping. But if somebody isn't going to either make money from the solution or save money by using the solution, it doesn't matter.
Right.
It's not going to be adopted by the market. And so really important for entrepreneurs to really get to know healthcare. And even if they come from healthcare, it doesn't mean you really understand healthcare. It's just incredibly complex, and depending on what part of it you're going into, you really need to do your homework up front.
Yeah. I mean, I think there's a lot of reliance on value-based bundled payments, right? And people would love to see that become reality, and it certainly is, Medicaid and Medicare. But Medicare is obviously huge, but there's still a small segment of the population, and most people are still commercially insured. And figuring out how you still play in a volume-based world with an eye towards the value-based world is where I think startups can really excel. And it's not just about the data, like you were saying, and it's not just about engagement. It either has to create, value creation or value or cost decrease for the payer, whether you're going for the provider or the payer. And those are the things that will enable folks to really build sustainable businesses around it. And then it's also understanding, like you were saying, those funding mechanisms, right? And reading through the CMS notes every year and knowing what are the ways that you can increase a star rating through an HCAP score, or what are the ways that a HEDIS measure will change. And if you build solutions that impact those small things that lead to massive groundswells of value for the health systems at large, then you really create something that patches into the business models. Because it would be like a consumer products company kind of coming to market with something that they said, well, people will just use it for free. Yeah. It just doesn't make a lot of sense.
Yeah, I do. Someday we'll be operating in a true value-based care environment, where a solution that improves somebody's health, manages their chronic diseases better, keeps them healthier, improves their wellness, will have an automatic home, and the economics will make sense. But we're not there yet. And to your point, most of care is delivered in a fee-for-service environment today. And there's a lot of technology today that can be applied relatively quickly that would work great in a value-based care environment, but isn't quite adapted for this kind of fee-for-service volume economics. And really important for people to understand that and understand where their business model is and how it fits in.
And what are you seeing with folks and the startups that you work with in terms of integrating into the clinical workflow?
The ones that are most successful spend the time up front to understand what the clinical workflow looks like and how it is that they can make whatever part of the clinical workflow they're trying to influence, that they can immediately make life easier for the people who are part of that workflow, whether it's doctors or nurses or techs or administrators or whoever it is, and that the ones who don't do enough homework up front, or who assume that their solution is going to be that it will speak for itself, that the value that it creates is going to be, just so obvious or so evident that people will change their workflow in order to use it, are really hard to get traction in that vein.
And do you think that the blocker there is because interoperability is so hard, or is it that folks are thinking too much about the end solution and not the full value chain in getting to the solution?
I think it again depends on what part of the workflow you're talking about. If you're saying to doctors you need to do something differently that's going to take another, it's only going to take another 2.5 minutes per patient. you got to understand that, if it's a primary care doctor and they're employed by a health system, they probably have, 10 or 15 minutes per patient, and then you're taking up 25% or, of the time with the patient to do something different, and that is probably a non-starter. And there's different configurations of that don't work. In terms of the interoperability, they've yet to meet a health system or a provider that wants to manage 40 different point solutions for different conditions or different situations. They want everything integrated into a platform as much as possible. Mm-hmm. And that platform today doesn't really exist. The medical records aren't really doing that today. There isn't a system that does that, and so I absolutely sort of see that as a barrier. Mm-hmm. And there's some workaround solutions, and that we see, but that's a challenge.